Hello, everyone, and welcome to Live in the D Extra. And as promised, we are continuing the conversation about scar revision with Dr. Khan and Miss Juanita Weston. So we're going to go over some of the things that we talked about in studio, get to some of your common questions, and just recap some important things that you need to know about scar revision. And Dr. Khan is going to walk us through all of it. Thank you for hanging out and staying with us to talk more about this, Miss Weston. We appreciate you. So the thing that is a big question for people is, how long does it take a scar to settle, and what does that mean?
So the scar from the day of the injury to the time where it truly settles, it can take up to a year, year and a half, depending on the nature of the scar itself, what caused the trauma, was it a surgical incision? And this is the 4 different phases of wound healing that the scar goes through. And essentially, what is a scar? It is the body's own way of healing and essentially taking care of a problem so that it wants to correct itself. And sometimes it overshoots, or sometimes it forms a scar because of the tensions, or sometimes from the way it was closed from the time of the injury.
That's interesting. Okay, so the way that the injury happened plays a big role in what kind of scar that you're going to end up with.
So I can expand on this. A surgical incision is probably the best scar anyone wants to have because it's a sharp blade, it's new, and it's super sharp, versus someone, for example, Miss Weston, it was a crush injury from a car accident where you have high impact trauma from a metal hitting the soft tissue, the skin, and then you have bone underneath. So essentially that compressing and compacting the skin so that now the body itself heals with a scar. You may have a dog bite, which is a crush injury, where the teeth of the dog essentially jab into the part of the body, and then you have, more importantly, the avulsion, where you have a rip. And that is basically the worst part of the injury itself. So these, as you can see, just a very brief summary of 3 different wounds, 3 different scars, and you can imagine the third one being the most involved just because of the nature and mechanism of the injury. Okay,
so let's say someone has a new scar. What can you do, or a new injury, should I say? What should you do to prevent a bad scar from forming?
Sure. So the first thing is we need to assess, and I will tell you, God has instilled in us this mechanism to say, oh, this is just a paper cut. This is only superficial. Because if it's just the top layer of the skin, which is the epidermis, it's going to heal automatically with regeneration. And you will not be able to see a scar in that wound. However, if someone, for example, has a deep cut, or like in Miss Weston's case, a full thickness penetrating injury where you see the fat layer, you know you have gone through the epidermis, the dermis, and the fat layer, and your best bet is to have it repaired definitively day 0 or day 1 by a board certified plastic surgeon, so that you close it in the 3 layers that the skin needs to be, from the deeper subcutaneous layers to the dermal, and then to the basically what they call the subcuticular or the complex closure, the 3-layer closure. Now this is very important. We hear about this all the time. Someone gets a bad laceration, they're riding their skateboard or the bike, very common in the summer. The kids are outside playing, they have a deep laceration, and you can tell also by the length of the scar. If it's long, then you know it's probably deep, and if you see the fatty layer, then you know.
Then you really know.
Then you know. And so the best bet is to get it suture repaired. We have seen this multiple times. There you go to an urgent care setting or to the emergency room, and then what was done was a gluing of the wound itself. And what the gluing does, it certainly puts the topmost layer together very nicely, but what happens is the inner deeper layers are not approximated well, and what that does is inevitably the wound opens up because there is not closure at the deeper layers, the foundation.
That makes sense.
And so now only what happens next is, for example, if it opens up, the glue may go inside the wound itself. Now you have, by definition, a foreign body within a wound, and that will heal relatively not well compared to the definitive closure. So I tell all my patients the best closure and the more definitive closure is to get it done in the 3-layer complex, not just the nylon going around all the way 1 layer, because you want to be able to approximate it, and hence what they call in the medical terminology a complex closure.
Complex closure, okay. So now, what makes a keloid form?
So keloid is a definition of a scar that heals where it basically bypasses the boundaries and it overshoots and overreacts. And sometimes it is a genetic predisposition, some ethnic groups, people of color, for example, or in some patients who, for example, would not form a scar on the volar side of the forearm, but they may be predisposed to on the chest, on the ears, or on the shoulders, because these are the areas that are notorious for forming keloids, versus hypertrophic scarring, which is basically an exaggerated version of the body's wound healing. So you have a small bump, or maybe sometimes an indentation that may form, and the scars can be very tricky to manage, especially the keloids, like in Miss Weston's case. If I were to go ahead and excise it with my blade, she is predisposed to, so we have to do something more, and we have to be smart, and the real genius in the plastic surgeon lies in to be able to tackle it such that it will not recur. It may look very sightly 2 months out, but the ultimate question you want to ask yourself, how is it going to look 2 years out?
Right, right. And Miss Weston, what did it mean to you to have Dr. Khan really be able to talk you through it and really give you a sense of hope? Because a lot of people told you there's nothing that could be done, right?
Absolutely. It meant everything to me, Tati. I was very traumatized in high school. You know, people talk about me, about everything. And that scar on my face was just one more thing that people had to pick at me about. And it made me so uncertain about myself. But when he assured me that he could give me my face back, it just opened up a whole new world for me. It gave me my self-confidence back, my self-worth back, and it was just amazing.
It is indeed amazing. So we have some questions, some common questions, Dr. Khan, that you get from patients. Let's go through those. So the first question people are going to want to know is, what can I do to make my scar look better?
So the most important part or time is day 0 when the injury itself occurs. We have to manage it definitively, because if this is, for example, a piece of wood that went deep within, or a piece of metal, we have to be able to irrigate, wash out the wound so that the bacterial burden, the debris, whatever it might be within the wound needs to be removed, because the body itself is going to try to heal around it and essentially overshoot a scar that may look worse because it was not cleaned. It was a dirty wound, like gravel within, like say a face abrasion when someone falls off a bike, or a car accident when someone hits the side and they have a full thickness laceration. You have to be able to close it such that it's clean. So that, what I find from my experience, is very important, and amongst the many things, making sure that you're up to date with tetanus, and that essentially with the body's immune system trying to fight off an infection, we basically supplement it with some antibiotics depending on where it is. Now, the other things that we can do ultimately when the scar settles is massage, and that is the take-home message. What someone does, and when I use the word massage, essentially, if this is a cut that I have, by gently in a rotation, you essentially apply gentle pressure, and I always tell my patients 3 minutes, 5 times, 10 times per day, depending on what and how mature the scar is. And what it does is it does actually 3 things. Number 1, it calms the nerves down that went haywire, that basically were traumatized, and these are small microscopic nerves at the level of the skin. So you calm those nerves down so that it's not a painful scar. Number 2, what it does is it causes nerves to come in an orderly fashion towards the scar, so that when you pass a piece of cloth over it or your finger, that you have sensation that is there, and you can have good 2-point discrimination. And number 3, last but not least, and very importantly, the collagen lays down like this in a disarray. So it's basically uneven, and when you massage, it basically calms it down so that it lays down nicely and it's nice and smooth, and you essentially tame this wild scar. And essentially what it does is it really, really, really enhances how the scar projects itself. You're not going to see the results in a week, but it takes months and months, and I tell the patients, if they get injured today, you're going to be doing it through next spring, and you will be surprised. A patient who does it routinely, religiously, and who is focused on it versus someone who does not, you will see two different, very different results.
Wow. And it's so simple.
Yes.
But you
yes.
wouldn't think it would do so much, just
Right.
being consistent and do it over time.
Right. And if I just may mention, whenever you massage, you put a moisturizer. So as you will see, the vitamin E cream, very good. Aloe vera, natural
Okay.
product. And then also you have olive oil, very good. So between the three, whatever works best for you, massaging it in will ultimately help keep the wound moisturized. So that's a
Okay.
very important tool to have, so that number one, many people try to scratch because they're itchy. That essentially fuels the fire, which makes the scar worse. So when you massage it, it helps calm those nerves down, which is the point number one that I mentioned, and always keeps it moisturized, because the scars can tend to get dry and as a result scaly, and just like eczema, they tend to itch. So essentially you address that burden as well by massaging with a good moisturizer.
It's a good moisturizer. Did you massage, Miss Weston?
I did
Okay.
with vitamin E oil.
Okay, okay.
Yeah.
So here you had a good patient.
Yes, yes. You know, I
Got
will
a good
tell you,
result.
if a patient, who understands, and it is, with Miss Weston, looking at the scar, it's a protocol that I set up because of the nature of the repair. You don't want it to be done sooner, and the next thing you know, you may put tension and open up the scar because it's at the angle of the mandible. There's a
Okay.
lot of movement. And again, the key in doing this is to be able to reconstruct the deeper layers, so the stress on the top is minimal, so that, because that's what everyone is going to see.
Got it. Okay. And here's a very important question. Should people avoid sunlight as their scar is healing?
Yes, so very important. There is the UVA and UVB rays that are very, very harmful to a scar, let alone skin. So that if a scar is healing and you let the UV rays hit it, it's going to essentially burn that scar more than what it would the other part of the body. So it's very sensitive. So I always say sunscreen is very important, especially on sunny days where you're going to be exposed. And this is when you're in the car and you have your hands out, the sun is always hitting, more
Right.
so on the left side if you're a driver. So I always say, even with sunscreen, you may think you may have a false sense of security. And I tell my patients, it's like having a radar detector and you're driving fast thinking that you're
You're
not going
okay,
to get
yeah.
caught. But no, you will be more predisposed. And the key is, avoid the sunlight, wearing a cap. You can get garments that cover your skin so that you are protected from the UV, which will find a way. So if you're wearing a cotton shirt and you go out and saying, oh, I'm wearing something, no, that UV ray will go through the cotton
Wow.
shirt. It's the special garment that needs to be worn so that you're ultimately protected.
Okay, that's great. Now, last but not least, is surgery the only option?
I say to my patients, surgery is the last option. Now, surgery is the best and the smartest option day zero, because that's your window of opportunity in order to address and definitively cure the wound. Surgery, you don't want to intervene because the scar may remodel and mature during the 3 months, 6 months where you may avoid surgery. Now, sometimes initially when the patients present like 2 weeks or 4 weeks out from their injury, for example, they fell and they have a deep laceration on their forehead and it's through the muscle, then no matter what, even if you wait, you have to connect the muscle and then also the skin, because now we're looking at totally different. So in that case, no matter what, even if you wait the year, you are not going to be able to address this definitively.
Okay.
But I always say surgery, like say for example in Miss Weston, it was over a year before she came to me, and I said this is certainly, it's not going to get any better, and the first 6 to 9 months are key for a wound to settle.
Okay. Miss Weston, thank you so much for sharing your
Thank
story
you for
too.
having me. I appreciate you.
Because just seeing this incredible result that you got, it just means so much to people, and I know everything that Dr. Khan has done for you has meant so much to you as
Yes,
well.
it has.
The proof is in the pudding, and when you see it, that's when it comes to life. Dr. Khan, how can people get in touch with you to ask questions or have you help them?
So you can certainly reach my office. ExecutivePlasticSurgeon.com is my website. You can also go, I'm trying to teach the patients through Khan Plastic Surgery Academy so that they can learn more about the before, during, and after. Scars are very challenging. They have a personality of their own. You cannot just look at a scar and come up with a definitive answer. I will tell you, if Miss Weston went to 10 plastic surgeons, she probably get 20 different answers. You know, for example, in Miss Weston, I decided the steroids, I was not going to. I wanted to be more proactive. I was going to go ahead and excise this definitively. And this was just done under local. She was talking to me. She's right now talking to me, and I was able to numb it up. And then she went for radiation 3 consecutive days from day 0, 1, 2, 3, so that the chances of recurrence was essentially only 10%. So 90% chance it was not going to recur. Now we have so many different tools, modalities, as you will see, that we can do. Small things make a huge difference. For example, if someone has an abrasion, which means a superficial layer cut, you apply, as you will see, the triple antibiotics or bacitracin ointment to open wounds only. You don't want to be applying this to wounds that are already closed, because it defies the purpose. It's already a closed system. Peroxide, for example, as you will see, is
big no,
because it does certainly clean out the wound and the blood that's around, but it also harms the collagen. And so that's why we basically advise patients to stay away from the peroxide. We have the sunscreen right here. And then I find the zero form dressing, which is an antibacterial, also a non-sticky dressing. It allows for the wounds to be moist, because what happens is the cells creep up and cover the wound definitively and allows for a permanent closure, so that if you were to put water on the scar, just like the birds of the feather, you have the keratin, it prevents the water from going in. And we know that bacteria loves water. Wherever there is water, you find bacteria, and so we want to go ahead and minimize the burden, especially with this. Another very, very important product that I use is the silicone sheet. And essentially, as you will see, this is a product where you can go ahead and I'm going to open this up for the first time. Essentially, it's like a big band-aid, and what it does is you have this thick silicone right here, and as you can see, you apply it directly on top of the wound. It's like a sticky, and so what it does is it's sticky, and so you put this over here, you can feel it allows for the water / content, the stress on the wound. And also, if you were to itch at night reflexively, you may not know, this will work as a very nice barrier. And also it allows for some pressure therapy as well. So very, very effective. I find it's very thick, and it does a wonderful job versus many of the other silicone products that we see in the market, which are a fraction of the thickness. So I find this is extremely, extremely good, especially long run. If you're at work for 6, 8, 12 hours, you can be wearing it because you won't have the time to massage. Or if you're sleeping the 8 hours, this is working while you're sleeping. And so this is, and you can peel this on and off, and works very effectively.
So it's you take a very multi-pronged approach.
Yes. And very, very, the scars, like I said, are a different personality, and it's a multi-modality approach, working very closely with the patient. And like I was telling you earlier, 50% maybe what I do surgically, but the other 50%, like Miss Weston did wonderfully, was follow the instructions, and it helps translate into a very, very nice scar ultimately. Another very important product that I use is Integra. Now, first we define the injury, we define the wound, and then what is it that I need to heal the wound with. This is essentially artificial skin. And so basically it's a product of the cow collagen and the shark cartilage. Then you put it on, it essentially simulates the neodermis, which is the new dermis that forms. And then we put a very thin layer of skin directly on top, which is 6/1000 of an inch versus 12/1000, very thin, so that the donor site heats very well, and the patient has very good results. Major scar reconstructions, burns, and even cancer. I use this a lot, and very good product to use. We have steroids, we have radiation therapy, as you heard. There are lasers that can be utilized as well. A lot of tools in our box, but the real genius lies into how, when the patient presents, what they want and what is going to be the long-term outcome.
Right, and you personalize this for every person, just like you did for Miss Weston.
Yes.
All right, Dr. Khan, this is great information. And I think it's going to give a lot of people hope out there that there is a way for me to be better. Do you agree, Miss Weston?
I totally agree.
Okay.
Sure,
We
sure.
appreciate you.
You're welcome. Thank you very much.
Thank you, Dr. Khan. Executive Plastic and Hand Surgery is how you get a hold of Dr. Khan.
Thank
and
you.
on YouTube?
Yes. So YouTube, Khan Plastic Surgery Academy. I hope to teach the patients. You know, there are people who are getting injured all the time, you know, and so we don't know what to do. Should I go to the doctor? Should I go to the plastic surgeon? Should I go to the emergency room? I have to say, hopefully that will at least be some insight, because we have not talked about fat grafting. That's another way to deal with wounds where the stem cells, for example, or within the fat helps nurture. You have PRP, plasma-rich plate, basically that will enhance the wound, amongst the many other tools like fractional CO2 laser, which will further enhance. Few things, sun exposure, that has been shown to really hurt the scars. Getting a good night's rest is something very important, because that's why they say you need to get your beauty sleep, because what happens is it's ultimately attached to cortisol, which is the stress hormone, and so you want to be able to have appropriate levels, otherwise you're going to age faster and you're going to have more of a tired look.
Okay. All right, Dr. Khan, excellent information. And Ms. Weston, thank you so much for sharing your story. And you guys drop questions for Dr. Khan. He'll be checking the Facebook Live and giving you answers. And of course, reach out to him when you can. You can go to his Facebook page. You can go to the website. You can go to his YouTube channel. Dr. Khan, Ms. Weston, thank you so much.
Ms. Weston.
See you guys soon.
Thank you.
Bye-bye.
Thanks. Bye-bye.